Thank you, everyone. At Mayo, we do believe that the dogma of one medication, one medicine, one care fits all does not work anymore. We see patients with different types of diseases. We see patients with a lot of different illnesses, and almost every patient get the same treatment. We don't think that's right. We think medicine should be individualized, and we should be able to give you the medication that works for you, and only you. To do that, we leveraged Mayo Clinic large data sets. We have more than 2.5 million patients on whose we have their entire medical history. From notes, the clinical notes we use, their laboratory results across more than 25 years. We also have all of their pathology reports, all of the biopsies and surgical pathologies that we would get, all of their imaging, whether there's x-rays or CTs or MRIs. We have all that data. But we also have one very important data set that we wanted to leverage, which was our genomics data set. We have 100,000 full exomes of our patients. Those exomes are combined with the clinical presentation of the patient. So we wanted to create multiple different encoders that are able to digest this information, create different embeddings for each of this information, and be able to seamlessly connect and give one prediction for one disease at a time. We wanted to make this as modular as possible, so different diseases, different researchers can apply this to different patients. But also we wanted to make it very powerful. Hence we partnered with Cerebras to actually start the process of designing our first genomic encoder. We have a 1 billion parameter state-of-the-art model that is able to take the raw reads from a patient's exome and make sense of it within the clinical setting. It combines that with imaging, in this case, x-rays, for example, and then our language encoder that is basically trained on almost all of our nodes, and is able to combine that information to tell the clinician, this patient you're seeing with heart disease, you probably want to start them on medication X rather than using medication Y. They will respond better. This individualizes medicine to a point where I know that every patient I see, I will treat them as differently as they deserve to be treated. This is just the first step. The future starts here. Our next steps include designing a longer context genomic encoder, which is what we're working on at this point, where really the patient's entire exome becomes a digital fingerprint. They take that digital fingerprint and they take it with them to any hospital they go to. It has all of the information that any provider needs to make an informed clinical decision. That's the future of medicine. That's what we believe in. And that's why we are working hard to make a multimodal like this possible in our lifetime. Thank you.